In this video, we're going to talk about 5 common things seniors say to their doctors that might be silently affecting their health. You might think you're being polite, but those words could be stopping you from getting the care you truly need. Many seniors say things like, "I'm fine," or, "It's just old age," without realizing it can lead to missed opportunities for early treatment or diagnosis. We're going to uncover these phrases and explain why they can be harmful. By making just a few changes in how you communicate with your doctor, you can improve your healthcare and feel more confident in your appointments. So, stick with me as we go through these 5 key mistakes, and how you can avoid them for better health. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. Point 1, saying, "I'm fine," when you're not. One of the most common things seniors say at the doctor's office is, "I'm fine." It sounds simple and polite, right? But here's the problem, it might not be the truth. You might be dealing with pain, fatigue, or other troubling symptoms, but because you don't want to bother anyone or seem weak, you say you're fine. The issue is, when you tell your doctor everything is okay, they might not dig deeper to find out what's really going on. This means your symptoms get overlooked, and you miss out on getting the right care at the right time. I know it's tough. Many of you grew up with the idea that you should be strong and not complain. And I completely get that. But the truth is, holding back your feelings at the doctor's office can actually hurt you in the long run. It's not about complaining, it's about giving your doctor the full picture. When you're open about how you're really feeling, your doctor can help you find a solution, whether it's a treatment or just the reassurance that everything's okay. I once spoke with a woman named Martha who always said she was fine. But in reality, she was dealing with dizziness and shortness of breath. She waited so long to mention it that by the time she did, her condition had worsened. Had she shared what was going on earlier, her recovery would have been much quicker and easier. So, remember, saying, "I'm fine," might seem polite, but it can quietly rob you of years of good health. Your doctor is there to help, but they need to know exactly what you're feeling. Don't hold back, being honest about your health is one of the best things you can do for yourself. Point 2, saying, "It's just old age." Another phrase many seniors tend to use is, "It's just old age." It's easy to brush off aches, pains, memory lapses, and other changes as simply part of getting older. And while some discomforts are indeed a normal part of aging, many times, it's not just old age, it could be your body signaling something more serious. When you downplay your symptoms and tell yourself it's just aging, you might miss the chance to catch a health issue early when it's treatable. This mindset often comes from a place of fear. I know many of you grew up in a time when enduring pain and discomfort was seen as part of getting older. It's hard to admit that something might be wrong, especially if you're used to pushing through. But here's the truth, not every ache or pain should be ignored. Some health conditions can be treated or managed if they're detected in time. Take Frank, for example. He was 72 and kept telling his doctor that his chest discomfort was just old age. He didn't want to bother anyone with what he thought was a normal part of aging. But eventually, the pain became unbearable, and tests revealed heart disease, something that could have been treated much earlier with far less risk. That delay cost him months of recovery and left him weaker than before. The reality is, brushing off symptoms with, "It's just old age," doesn't make you tough, it makes you vulnerable. Doctors are trained to differentiate between what's normal and what's a warning sign. When you're honest and share what you're feeling, you give your doctor the chance to help you before things get worse. Point 3, saying, "I don't want to bother you." How often have you found yourself saying, "I don't want to bother you," at the doctor's office? Many seniors feel this way, thinking their concerns might be too small or that they're taking up too much of the doctor's time. But here's the truth, you're not bothering anyone. Doctors are there to help you, and your health matters. When you downplay your symptoms or brush them aside, you risk missing out on the care you deserve. I understand where this comes from. Many of you were raised to be respectful, to value other people's time, and to never make a fuss. But in the doctor's office, that mindset can work against you. When you minimize your own concerns, you send the message that your health is less important. And over time, this can lead to rushed appointments, missed diagnoses, or issues that get ignored until they become bigger problems. Take George, for example. He was 69 and would always tell his doctor he didn't want to bother him. He ignored his sleep problems and constant leg cramps. Several months later, he ended up in the emergency room with a blood clot that could have been caught and treated earlier. His hesitation to speak up had serious consequences. The reality is, your health is never an inconvenience. It deserves time, attention, and honest conversation. By speaking up, you give your doctor the opportunity to do their best work for you. So, next time you're at the doctor's office, remember, you're not bothering anyone by asking questions or bringing up concerns. Your health is worth it. Point 4. Saying, "You're the doctor, you decide." Another common phrase seniors use is, "You're the doctor, you decide." On the surface, this might seem like a respectful way to show trust in your doctor's expertise. However, in reality, it takes away your voice when it comes to decisions about your own health. You are the one living with the consequences of the choices made, and your doctor can't make those decisions alone. This mindset often comes from a time when doctors were seen as unquestionable authorities. Many of you grew up in an era where you trusted the doctor to make all the decisions without question. But medicine today works best when it's a partnership. Your input, concerns, and preferences matter just as much as the doctor's knowledge. Without your perspective, even the most skilled doctor might not choose the treatment that's right for your lifestyle, values, or comfort. Take Ruth, for example. She was 81 and told her doctor, "You're the doctor, you decide." She was prescribed medication that ended up causing unpleasant side effects, and she struggled to manage it. It wasn't until she started voicing her concerns and preferences that her treatment plan improved significantly. The ugly truth here is that doctors are guides, not dictators. They bring expertise, but you bring the lived experience of your body and your life. By participating in the conversation, you can create a treatment plan that truly supports your needs. Silence might feel polite, but participation is what protects your health and ensures your well-being. So don't be afraid to speak up and share your thoughts. It's your health, after all. Point 5. Saying, "It's nothing, forget it." Perhaps one of the most harmful phrases many seniors use is, "It's nothing, forget it." This often happens when you feel embarrassed, worry that your concern isn't serious enough, or simply want to avoid the potential fear of bad news. But here's the problem: dismissing your symptoms or brushing them off as nothing can lead to missed opportunities for early diagnosis and treatment, sometimes with serious consequences. I understand why this happens. It can feel easier to pretend everything is fine, especially when you're not sure whether your concerns are worth bringing up. You might think that if you ignore it, it will go away. But the reality is, ignoring small symptoms today can lead to much bigger health problems tomorrow. Sometimes what seems like a minor issue could actually be an early warning sign of something that requires medical attention. Take Leonard's story. He noticed bleeding gums but quickly dismissed it with, "It's nothing, forget it." Several months later, he was diagnosed with advanced gum disease that had started to affect his overall health. If he had brought it up to his dentist earlier, the treatment would have been much simpler and far less painful. The ugly truth here is that no symptom is too small to mention. Your body communicates with you through these signals, and ignoring them doesn't make them disappear. By acknowledging and sharing your concerns, you open the door for your doctor to give you the care you need before something more serious develops. Never downplay what you're feeling. Your health is worth every conversation, no matter how small the symptom seems. Point 6. Saying, "I already know what you're going to say." It's easy to think we already know what our doctor is going to say, especially if we've been through similar health concerns before. You might catch yourself saying something like, "I already know what you're going to say," or "I don't need to hear it again." While it's natural to feel like you have a handle on your own health, shutting down the conversation before it even starts can be detrimental. Doctors don't just treat your symptoms, they take everything you've been through into account, and each appointment is an opportunity to reassess your situation. By thinking you already know the answer, you may unintentionally close yourself off to new insights or updated treatment plans. Medicine changes, and sometimes a new approach or treatment might be exactly what you need, even if it's not what you expect. I remember speaking with a man named Harold, who had been managing his diabetes for years. When he went to his doctor for a routine checkup, he started to say, "I already know what you're going to suggest," and brushed off a new suggestion for medication that could have made a big difference in managing his condition. Later, he realized that he missed an opportunity to improve his treatment plan just because he assumed the doctor wouldn't have anything new to offer. The reality is, each visit is an opportunity to listen and learn something that could improve your health. Don't shut down the conversation before it even begins. By staying open to your doctor's advice, even if you think you already know what they're going to say, you allow room for new solutions, better outcomes, and a fresh perspective on your health. Your doctor is there to help guide you, but you have to be open to hearing what they have to say. Point 7. Saying, "I can't afford treatment, so never mind." This is a tough one. Many seniors, especially those on fixed incomes or with limited resources, may say, "I can't afford treatment, so never mind." It's understandable to feel concerned about the cost of healthcare, but this phrase can prevent you from getting the help you need and deserve. When you downplay the importance of your health due to financial worries, you may miss out on affordable treatment options or even preventable care that could save you from bigger health issues later. I get that medical bills can be overwhelming, and it can feel like an uphill battle to afford the treatments or medications your doctor recommends. But here's something important to keep in mind: doctors are aware of financial challenges, and they want to work with you to find solutions. There are often payment plans, financial assistance programs, or even alternative treatments available that you might not be aware of. Take the story of Evelyn, a 74-year-old woman who was dealing with arthritis but dismissed her doctor's recommendation for physical therapy, saying, "I can't afford it." By putting it off, her condition worsened, and she eventually needed much more expensive treatment for severe joint damage. Had she started therapy earlier, the cost would have been much lower, and she could have avoided more extensive treatments. The truth is, don't let financial concern stop you from speaking up and getting the care you need. Your health is an investment in your future, and it's always worth exploring options to make treatment more affordable. Never assume that you can't afford the care. Ask your doctor about available resources or less costly alternatives. Taking action now could save you from more expensive or complicated treatments down the road. Point 8. Saying, "I don't want to know." It's common for some seniors to say, "I don't want to know," when they're faced with a difficult diagnosis or treatment option. I understand, it's scary to face the reality of a health condition, especially if it feels overwhelming. But here's the thing. Avoiding the conversation and pretending you don't want to know the truth can lead to missed opportunities for better outcomes. Knowing what's going on with your body, even if it's tough to hear, is the first step toward making informed decisions about your health and well-being. When you say, "I don't want to know," you're not helping yourself. Instead, you're limiting your options and possibly delaying treatment that could improve your quality of life. Doctors are there to guide you through tough times and provide clarity. They can help you understand your condition and explore the best treatment options, no matter how challenging the conversation might be. Take the story of Dorothy, a 68-year-old woman who was afraid to hear the results of a routine test. She told her doctor, "I don't want to know." The doctor respected her wishes but explained that avoiding the information wouldn't stop the problem. Eventually, Dorothy agreed to get the results, and it turned out that early treatment could have prevented serious complications. By delaying the conversation, she made things harder on herself. The reality is, knowing the truth, whether good or bad, gives you the power to take action. You might be afraid, but once you know, you can start working on a plan to feel better, manage your condition, or even heal. Don't let fear hold you back from getting the information you need. When you know, you're not just facing the truth, you're giving yourself the chance to make choices that can lead to a better life. So, there you have it, the 8 common phrases that many seniors use without realizing they could be affecting their health. From saying, "I'm fine," when you're not, to brushing off symptoms with, "It's just old age," or even shutting down conversations with, "I don't want to know," these habits can silently impact the quality of care you receive. But the good news is, by changing just a few things in how you communicate with your doctor, you can make a huge difference in your health journey. Remember, your doctor is there to help you, but they can only do so much if they don't know the full story. Speak up, share what you're really feeling, and never be afraid to ask questions or voice your concerns. Your health is important, and you deserve to be heard. Thank you for taking the time to watch and learn. I hope these insights help you feel more confident and empowered when you visit your doctor. If you found this video helpful, please leave a comment below and share what you plan to do differently in your next appointment. And don't forget to like, subscribe, and share this video with others who might benefit. Your support helps us keep making content that matters. Take care of yourself, and I'll see you in the next video.